Well, we'll go ahead and get started and take a roll call and see if we've got a quorum. Good afternoon, everyone. Today is September 11th, and this is a properly noticed meeting for the Silver State Health Insurance Exchange. We are transmitting between here in Carson City and our office in Henderson. And I don't have any particular announcements this morning. Do you, Mr. Gilbert?
I do not.
Okay, thank you. Why don't we go ahead and do the roll call and make sure that we have an agenda or have a quorum this afternoon.
Very well. Chairman, Ms. Smith-Campbell.
Here.
Vice Chair, Ms. Atkins.
Here.
Ms. Johnstone.
Here.
Ms. Lewis.
Here.
Dr. Jameson. Ms. Kerr.
Here.
Dr. Ford.
Here.
Mr. Gilliland.
Steve Fisher sitting in for Mr. Gilliland.
Commissioner Kipper.
This is Todd Rich, proxy for Commissioner Kipper.
And Ms. Teska.
Here.
Thank you. We have a quorum.
All right, thank you. Before we do get started today, there are a couple of things I wanted to say. First of all, on behalf of the board, we wanted to extend our sympathy to Ms. Atkins for the loss of her mother recently, and we're all very, very sorry for that loss for you. And
Thank you. I appreciate that.
And secondly, today is September 11th. It's a very somber day for our nation. And I wanted to acknowledge all those families that have lost loved ones. Know that you have our thoughts and prayers, and a great big thank you to all the men and women of the military that protect us every single day. So with that, I want to go ahead and open it up for public comment. Is there any public comment in Henderson?
No, there's not.
Okay. How about here in Carson City? All right. I think a lot of our participants are over in the halls of the legislature today. All right. I am going to move a couple of items around on the agenda. We'll go through agenda item number 3, which is the approval of the minutes, and then the executive director's report. And then, because we will probably be losing some of our board members early today, I want to move down to agenda item number 10, and then we'll go back in order. So have board members been able to look at the minutes from our meeting on August 14th? And are there any amendments, edits, or corrections to those minutes? If there are none, may I have a motion to approve, please?
Marie Kerr, motion to approve.
Do we have a second?
It's Leslie Johnstone. I'll second.
Thank you. All those in favor of the motion?
Aye.
Any opposed? All right, thank you. Motion passes. Then let's move on to the executive director's report, which is agenda item number 4.
Thank you, Madam Chair, members of the board. I'm going to begin with an apology because Damon has had some sort of stuff and he has given it to me. And I've been eating these menthol lozenges pretty much ceaselessly. So if my voice starts to waver in and out, you'll know what it is. I've killed off the cough, but now I'm still struggling with it a little bit. My report has been provided to you, and in fact, a number of reports have been provided to you. And what I would tell you is, from my perspective as executive director, overall, we're getting some pretty good news. The reconciliation efforts under the direction of our chief operating officer are showing progress and moving forward. Our preparation for the changeover to the federal enrollment and eligibility engine is going well. I think that overall the board should be very pleased as it looks around and sees where we are on these various tracks and as we move forward. I do want to take a few moments to acknowledge and express appreciation to some of our partner state agencies for the assistance that they have been providing to us as we move forward. First of all, with respect to the Division of Insurance, I very much appreciate, Todd, your being here, and I appreciate the efforts and assistance of Commissioner Kipper and all of your staff in assisting us in resolving consumer issues promptly. That's very, very appreciated. Thank you. I would also extend appreciation to Director Gilliland and everyone over at the Division of Welfare and Supported Services for allowing us to keep Steve Fisher around as the lead on our transition to an SSBM, which has been extraordinarily helpful. And also, I would note the counsel and help of Dave Stewart, the division's IT administrator, as we have been preparing for the movement to the federal system. He has done a tremendous job in assisting us in moving forward and making sure that all of the I's and T's are dotted. I's are dotted, T's are crossed. It's those lozenges. And that we don't overlook anything as we move forward in our transition. The level of assistance and cooperation which we have received from our other state agencies has been simply extraordinary, and they're certainly making our pathway to a successful future easier than it otherwise would be. The other topic that I would like to address involves the upcoming open enrollment and specifically bringing additional resources to bear to help assure that we have a better open enrollment experience than was the case last year. In my estimation, and as I've shared with the board and frankly anybody who would listen to me, the upcoming open enrollment is our benchmark. It is our metric for success, and it will be the sole, essentially the sole matter upon which we will be judged. Every resource that we can bring to bear on it and every hour that we can spend working specifically on that are very important, and we have to do all that we can to make certain that the open enrollment process goes well. Consequently, as everyone knows, staff has recommended that the exchange either discontinue or table its efforts toward the procurement of another platform for enrollment and eligibility for plan year 2016. Shauna's report, I think, does an excellent job of setting out the reasons for that in detail. I think that you will find them compelling, and I also believe that by following that path, it will allow us to concentrate on what is essentially job one, which is an improved open enrollment experience. And that would be the sum and substance of my report, Madam Chair. I'm available for questions if anyone should have any.
All right, do any board members have questions or comments for Mr. Gilbert? Okay, thank you very much then, Mr. Gilbert. Then let's go out of order here and go over to agenda item number 10, which is the update on the Silver State Health Insurance Exchange Alternative Acquisition Survey for the year 2016. And who on staff is this Mr. Roos? Okay, Mr. Roos.
I will
Thank
take
you.
that one. For the record, Shauna DeRoos. As our executive director just mentioned, this is not a report that I think we undertook lightly, and it's certainly not a report that we take pleasure in bringing for the board. As you all recall, we've been working on the alternative acquisition procurement. We'll call it the survey. The survey went out on July 31st. We sent it to 9 different organizations. We did get a response from 4 organizations. One of those was a no response, but they sent a nice letter saying thanks, but no thanks. Of the 3 that we did respond, we started down the path. And while they were very comprehensive responses, what we have been finding, let the record show that Dr. Jameson is joining us here in Las Vegas.
Thank you.
You're welcome. What we are finding is that there are outside sources that are affecting not only the survey, which we've been calling track 3, but also track 1 and track 2 of the different projects that we have going on at the exchange right now. So we put together the report that showed that while we can continue to go forward and go down the path, we've included the schedule, we've included the responses, we have some concerns with moving forward. We have discussed in the past the financial viability of the exchange moving forward with a new vendor just in general. Knowing that our enrollment as we head down into the end of this plan year, as we go and we're starting to process terminations, our enrollment peaked at almost 39,000. We're hitting 34 to 35,000 right now. We suspect that will continue to decline as we get towards the end of the year. Knowing that everybody has to come back in and re-enroll, we fully expect our January enrollment numbers to be, even lower, February low, and hopefully we build back up and we are very successful and we get back up to a higher amount. But to bring in a vendor, build a system, and then not know how many people we're going to have and be able to say, yes, absolutely, we will be able to afford to pay those maintenance and operations costs going forward is of great concern to all of us. So the financial viability is one that we look at from the exchange perspective. Not only that, we all know that the changeover to the SSBM project has impacted other state agencies. Welfare and Supportive Services had to revise and get $25 million from our federal partners. This also was a cost of about $3 million of general fund to the state. So even if we went ahead and we chose a vendor, the Welfare and Supportive Services budget does not include any kind of general fund. Our general fund does not include any kind of general fund that has been earmarked for this exchange process. So that is of great concern on the financial viability as well. Impact just again on other projects. Damon is our project manager for Track 2, which is the transition to the SSBM. And there are only so many of us, and I hate to harp on that, but with the few people that are working on this, even bringing in PCG, even bringing in Natoma as our PMO office, what we're finding is that the staff and their knowledge is being pulled in so many different directions. When I need to pull then staff, say from welfare or the Division of Insurance or the other agencies even to help with that survey, to spend the time reviewing. This is time away from this very important project of the SSBM transfer. So this is a great impact on their time and their ability to get the very important work done to make this a success. Again, timing. We had some concerns at the May board meeting that we are going down a path and we're saying we're going to switch to a new vendor and we're going to build this new system, and we are actually not even sure at that point what kind of success that we are going to have with the transfer to the SSBM. And unfortunately for us, the deadlines from our federal partners on having to put in that grant application on November 14th before we even start our open enrollment, worst timing ever, I think there. So knowing that we would have to make that decision before we even know if this is a success, that makes it, I think, also a very difficult situation. So with all of this, and it sounds like it's kind of overwhelming, I want to say again, we can absolutely go forward with the board's previous course of action and direction to the exchange staff, but we also wanted to make you aware of the current situation and the effect that this was having on everybody. So we provided a couple of options. Well, option one, stay the course. For all the different reasons that I just stated, we could stay the course, we could do the evaluations, we could go down this path, and we could hope that we get the funding, that we get the general fund, and that the Welfare and Supportive Services is able to get their funding for any changes required from our federal partners. Option two, which is really what we're here to talk about today, is the cancellation of the alternative acquisition. A motion to cancel this would free up the staff from all the agencies. I think it would enable us to have greater success probability on Track 2, which is really our focus right now. As our executive director said, this is our benchmark. This is where we have to be successful this time. I think that if we are successful in Nevada, we're successful and we're great. And then there's no reason to go to a new vendor. And if we're not successful, then we join the country in not being successful if the infrastructure is not working. And I think that opens up an entirely different discussion if the country is not successful. Then it's not about Nevada any longer. So the staff is recommending that we cancel the alternative acquisition, and we obviously are open to other direction from the board members. And so saying, I will turn it over for questions.
And I'll open it up for discussion from board members to Mr. Roos or to Mr. Gilbert, either one. And please, our ex officio members who are very intimately involved with this, I would appreciate comments from you as well, please.
This is Julia Tuska in Carson City, and I would support the staff's recommendation for a couple of the, in particular for a couple of the reasons that Shauna outlined. One is that these decisions are having impacts on other state agencies, and I understand this was not the original path or vision that this board had in mind, but ultimately our goal is to get a vehicle for uninsured Nevadans to acquire insurance through an exchange. That's what our goal needs to be, whether it's an exchange that's our creation or whether it's using the federal infrastructure. We've already, with the having to go through two versions of this, we've already had to expend state resources twice. I would say that a third time we would be pushing our luck in terms of being able to get something like that approved. And also, it's not just the resources from a financial perspective. I won't speak for Mr. Fisher, but I'm fairly certain that the staff at his department have other things to do besides create interfaces between the exchange and Medicaid. And that seems like that's all they've been doing for the last couple of years. But the other is that we have to think about our customers and the citizens and having a third different system in 3 years with a different enrollment process. I don't think discouraging our customers is even a strong enough term. I think that it would be, we're concerned about the confusion going from 14 to 15. If there was a third separate one in 16, I would congratulate any of our customers who could get through that process. And I think they would deserve an award just for staying the course and sticking with us through that. So I really support the staff's recommendation because I think it's what makes sense, and it sends the right message that we believe in the direction that we're going, and that this open enrollment is going to be successful. I think continuing down this other path is sort of saying we're not sure we're going to be successful, and I think we have to have some belief that we're actually and some real. We're going to make this work. I think we need to do that as far as our 2015 enrollment. So,
thank you, Ms. Keska. I appreciate your comments. Do we have comments from any other? Mr. Fisher?
Yes, thank you very much.
So nice to have you here.
Thank you. For the record, Steve Fisher. I'm representing DHHS today. And for the record, yes, our number one priority is a successful open enrollment period. And in order for that successful enrollment period to occur, we must have two successful projects. One, we must have a successful state-based marketplace project, and we must also have a successful wind down of the Xerox project. Those two projects must be successful. And I do echo and agree with what Ms. Tuska said. And in addition to that, we also have concerns on the DHHS side with regards to the cost of moving forward with this particular option and the general fund costs that may occur with regards to, I'll use the term coupling and recoupling or uncoupling that we've talked about in previous meetings, and the cost of hiring the technologists to come in and do that work. So on behalf of the department, I do agree and support the recommendation that has been put forth today with regards to this particular project.
Mr. Gilbert, do you? Oh, I'm sorry. Sorry, Todd, I didn't
That's okay.
see that.
Good afternoon, Madam Chair. Thank you. For the record, Todd Rich, Division of Insurance. From our perspective, really fundamentally, we're trying to do two things. One is make sure we have a good, competitive, stable marketplace where our regulated carriers can understand what the guidelines are and the rules, and they can offer plans, and it's competitive and it drives the cost down for our consumers. Secondly, we want to make sure the consumers are treated well, and I think everyone recognizes year one was a challenge on both of those fronts. Our staff has worked very hard, both with the Xerox system and now with the federal system, and I'm really happy to report we were successful this week in transferring every plan to the federal site. Everything went through. We can see the carrier's plans, This never happened under the previous system, so we're very excited about that. And I think it's in everyone's best interest that we continue on with the federal system. I know one of my staff members is working on the RFP committee. It's taking up a lot of his time. For us and the carriers to work on a third system in 3 years would be very challenging. We will do whatever you need to help make the exchange successful, but our recommendation is to follow Mr. Gilbert's recommendation to stay with where we're at right now.
Thank you, Madam Chair. For the record, Bruce Gilbert. I think the case for discontinuing this effort, this procurement effort, is fairly compelling. Staff has discussed it extensively, and I've shared my opinion with various members of the board. I think that the comments of Ms. Teska, specifically with respect to the consumer experience, are very well founded. A third change would create an entire series of obstructions, if you will, that could make it difficult for our targeted population to be able to succeed if we move forward. Additionally, when you take a look at the project resources which have been committed to what we call Track 3 or the procurement process, whether we're talking about the human resources, the money that's been or will be expended, and the opportunity costs of not being able to redirect resources to our primary projects, I think it certainly presents a very strong case for moving away from this track. I was particularly struck by Mr. Rich's comments with respect to the successes that we have had in terms of being able to see the plans actually on the platform, going through the testing, making sure that we're doing everything possible so that we are positioned well when open enrollment comes. And those are things that did not happen previously. So I think that overall, it's a very strong case to move in this direction. I think Mr. Roos did an excellent job in setting out the options, and I would urge the board to follow the recommendation as made by staff.
Madam Chair?
Yes. Ms.
Go ahead if there's someone else.
This is Marie Kerr. I have two questions. Have we checked outstanding legal challenges to ensure and that's not just within the state of Nevada, but across the nation, to ensure that subsidies to our consumers are likely to continue if we remain in SSBM? That was the first question. These really both go to cost to consumers going forward, and kind of thinking ahead a little. Second, do we have assurances from CMS that our consumers will not face additional fees in the future if we remain at SSBM and we don't go into the transition? And so, you may not have answers to these questions, but I think they're certainly worth looking into before we jump to a big, before we move forward to do something that we may not be able to undo.
Madam Chair, if I may. For the record, Bruce Gilbert, with respect to the question regarding legal challenges, the Hallbig decision, which was the decision that determined that subsidies were not payable in certain circumstances, it's sort of a standalone, but notwithstanding that fact, basically the holding of that case was that subsidies may not be available where there are not state-based marketplaces. We would remain a state-based marketplace, although supported by and using the federal enrollment and eligibility platform, but that would be no different than any other platform that we might choose to use for enrollment and eligibility purposes. So from that perspective, I feel very, very confident that we position ourselves such that we don't have to worry about the subsidy question. As far as additional fees in the future, I do not have an answer to that. I don't know that CMS is capable of giving us an answer to that at this point in time. I can foresee the opportunity where they would say to us at some time in the future, it will cost you X to take advantage of the infrastructure. My recollection is they charge 3.5% of the premium in order to offset the cost, but that's on a truly federal marketplace as opposed to a supported state-based marketplace. So while the question may very well come up, and I wouldn't be surprised if it does, I don't think it will put us at a disadvantage.
Ms. Atkins?
Madam Chair, I think I would just say that in the spring, I think when the board decided to move away from the the prior vendor that we had, I think it was the board's strong belief that we couldn't continue to go down the path we were going, and that's why we decided to make the change. I believe when the options were presented to us, I think even at the time we did not know that this kind of hybrid approach was available, and I think we learned that a little bit later. And I think it's an exciting approach that I think we're all looking forward to. So I think that being said, I think we have more information now, and I think staff has worked very hard at figuring out what our options are, what the timelines are, what the costs are, and I think has made a compelling case that now that we have this information, that this going down track 3 does not seem in the best interest of Nevada, nor of the exchange, nor of any consumers. So just as we're talking, I just wanted to express my support of staff's recommendation.
Do we have any other comments from board members? All right. Well, I would concur with what Ms. Atkins has said. I know when we first went down this path, we did it with very limited information and facts, and the whole emphasis was on keeping the exchange a state-based exchange and getting us into a protected position. Given the new facts, I would support the staff's recommendation on this too, and we do have very, very limited resources with the number of people that are working on this, and I would say that the goal should be successful enrollment for 2015, and that we stop anything with the alternative survey so that our limited staff can focus on that successful enrollment for next year. And I think that's what our Nevada consumers want too, most importantly. Anyway, those are my thoughts. If there isn't any other discussion, is there someone that would like to make a motion on this?
Connections for the record. I move that the board directs staff to cancel the alternative acquisition of a vendor for 2016.
This is Dr. Ford. I second.
All right. Is there any further discussion? All right. I'll go ahead and call for the vote on that. All those in favor of the motion?
Aye.
Is there anyone opposed? All right. The motion carries. Thank you very much. And I do want to thank Mr. Roos for all the hard work she's put into this. And I do want to thank all the vendors that participated in this. But I think everyone understands the goal is to get a successful enrollment for 2015. All right, let's jump back to agenda item number 5 and talk about the transition update as a supported state-based exchange.
Thank you, Madam Chair. Damon Haycock for the record. I'm going to briefly go over some of the key areas that I usually go over every month, but not go through the entire report in essence of time. As far as carrier onboarding, currently all of our carriers have received initial approval through CMS, and some have already started boundary testing the ability to accept an 834 enrollment file. Carriers are also prepared to begin the actual transference of those files in a testing environment and are awaiting CMS guidance as to when this will be available to begin. CMS has also notified us at the exchange and carriers that end-to-end testing will be made available beginning October 7th. The exchange will be conducting on-site visits with the carriers during this period to ensure participation and to provide assistance. We've also recently been approved by CMS, or excuse me, yes, we've recently been approved by CMS to access plan preview. So while the carriers are actively viewing their plans, exchange staff have the ability to also participate and be part of this process. We will also be participating in our own user acceptance testing with the federal marketplace during the week of September 22nd, where we'll be able to have an opportunity to complete an application, get an eligibility determination, and select plans as if we were a consumer here in Nevada. Finally, carriers have also been provided direction on guaranteed renewal and the re-enrollment process onto 2015 plans, and we'll be coordinating with each of the carriers in their marketing and outreach efforts to ensure a smooth transition into the 2015 plan year. Some upcoming deadlines and dates. The final SURF data transfer was performed on September 5th, as Deputy Commissioner Todd Rich had mentioned earlier. There's a limited data correction window where our carriers can go in and make small changes to their plans if there's aesthetic issues or something doesn't look quite right between September 5th and October 6th. And then all QHPs will be certified by the Division of Insurance, and the data itself will be locked down on October 10th. And of course, open enrollment begins November 15th. As far as plan certification, as Mr. Rich said, all plans have been successfully transferred over to the federal hub, and that final approved rates will be posted on the Division of Insurance's website on October 16th. We are pleased to announce that 154 total plans have been sent over to the federal hub, 4 of those being multi-state plans. As far as brokers and agents are concerned, the exchange has received reports that some brokers have completed all requirements to sell on healthcare.gov, so they've gone through the training and have been certified. On the other side, exchange enrollment facilitators, on Friday last week, September 5th, CMS released the 2015 training for navigators and certified application counselors. And the exchange is currently developing the process to identify those that will be trained to ensure that they get the training necessary to assist Nevadans come 2015 open enrollment. Last but not least, for Medicaid and Nevada Checkup, they have been working on communications as well as coordinating website messaging and linkages between welfare and the exchange's homepage. Their call center is also in preparation for changes, as they will now be able to accept applications over the phone. Deloitte, the contractor for welfare, is continuing to perform software development and testing efforts, and preparations for the welfare user acceptance testing has started. With that, you'll see there's a couple attachments to this report. The first attachment is what Nevadans can expect for the next open enrollment. I'm not going to go through all of this. However, I'll touch on some of the high points. So between now and March 2015, the exchange will still utilize our current vendor to operate the plan year 2014 functionality, as they own all of the processes through our current system. They need to ensure that they can assist Nevadans with qualifying life events and changes in circumstance. Then beginning November 15th, 2014 at approximately 8 a.m., we believe NevadaHealthLink.com will activate a link to a pre-screener tool that will help Nevadans see if they potentially qualify for a state-certified health plan, Medicaid, and or Nevada Checkup. This is critical to help Nevadans navigate through some of that confusion to get to the area that they need to go to successfully enroll in health insurance. Access Nevada, our partner over there with the Division of Welfare and Supportive Services, on November 10th, they will relaunch Access Nevada to assist Nevadans in applying not only for Medicaid and Nevada Checkup, but also TANF and SNAP programs. There's a section in this attachment that talks about relaunching NevadaHealthLink.com, but I'm going to save that for our partners, KPS3, who will be providing a marketing update, and we'll address the new homepage with everybody here later today. Additionally, there's more information on marketing and outreach, which will also be part of that later report. So with that brief overview, I'm willing to take any questions from the board.
Do you have any questions for Mr. Haycock?
Madam Chair, this is Leslie Johnstone.
Yes, Ms. Johnstone.
Mr. Haycock, that all sounds very good. Are there any areas that you're concerned about or that are currently behind schedule?
That's a very good question, Ms. Johnstone. Damon Haycock, for the record. There are always concerns about a project that's going to kick off in the next 2 months. We are concerned that the October 7th date for end-to-end testing isn't long enough. We would like to have at least a few more weeks in addition to what CMS is providing, but we will take what we can get. Additionally, we are concerned, as Ms. Teska has mentioned, about the consumer experience and the confusion of this new process. We are aggressively working with our marketing vendor and our internal teams, as well as our state partners, to develop the appropriate messaging to ensure that our consumers know where to go and what to expect. We were concerned about the onboarding of carriers, but it appears that they have all gone on to the federal marketplace. All their plans are now in plan preview, and we have developed and ramped up resources to assist them in this process. And that direct enrollment will be available for all of our medical carriers. And so we are very excited about that. But just the timing, to give you a short answer, Ms. Johnstone, is the timing. And with only 2 months left before we go live with our own website and a little over 2 months before open enrollment, we don't like to leave anything to chance.
Thank you. And one more question, Madam Chair. On the October 7th end-to-end testing, are we in competition with other states for CMS's time to do that testing and turn around fixes?
Ms. Johnstone, I don't know if competition is the right semantic for it, but we will be all accessing the same test environment across the nation on October 7th. So that is correct, although we have been informed that the testing environment that they have created will be able to account for all those participants.
Thank you.
Madam Chairman, I just had a question for Mr. Haycock.
No, go ahead, Dr. Jameson.
Yeah, Mr. Haycock, I just wondered if you could elaborate a little bit more on the on the training for the enrollment assisters. You said that they have a 2015 schedule now for the assisters, but that we're going to review and there would be a selection process. And could you elaborate on what you mean by a selection process?
Yes, Ms. Jameson. Damon Hickok for the record. I don't know if selection process was the most appropriate verbiage, and if I used that, I apologize. In order for certified application counselors and navigators and enrollment assisters to obtain the 2015 training modules from CMS, the exchange has to submit a list of folks that we have approved to take that training. And so in our best efforts, we hope that those folks could go directly to CMS and sign up the day training was open, and that CMS would inform us when they had completed it. We would be able to receive their certificates of completion and then certify them or appoint them with the exchange. Instead, we have to do it a little bit backwards, where we are going to request information from our current navigator entities as well as the certified application counselor entities and ask them who they want to submit for training. We will then, as their champion, send that on to CMS and let them know that to activate training for those folks. Once those folks have finished training and get their certificates, we will then finalize the appointment process.
So that perhaps some of those entities would not, for whatever reason, be submitting everyone that's currently a certified assister. I was just wondering, because we do want to have a really successful enrollment, I was just wondering if we were making some sort of criteria that could radically reduce the number of assisters.
No, Ms. Jameson, we are doing nothing of the sort. We have no desire to reduce the amount of in-person assistance for this next open enrollment period. We will be mandating that all of our current navigator entities, those navigators and enrollment assisters that are currently being funded by the exchange, will be required to continue to receive funding to obtain all of the training required to participate on healthcare.gov. As far as the Certified Application Counselor Program, it is a voluntary program. The exchange does not provide any funding to those organizations, nor will it continue to reimburse for that certification through the Division of Insurance. And so we will be pulling that information directly from them. And as they continue to increase staff or wish additional staff to attend training, we will submit that on their behalf. We have no desire to turn down anyone's training. However, no one will be able to assist Nevadans enroll in Nevada Health Link through healthcare.gov next year until they have completed.
And I just wanted to ask if you had plans to have quite a few of those training classes. I know last year there was sometimes not as many classes available as some of the people had desired who would like to get their training done.
So, Ms. Jameson,
so they quickly filled up, and they were kind of spaced far apart.
You are correct, Ms. Jameson, and to solve that issue this year, the exchange is not elected to provide its own 4-hour block of in-person training. We are simply going to rely solely on the initial training required for EEF certification through the Division of Insurance and the 20-hour course material that is self-study and online that navigators and enrollment assisters and CACs can take at their own pace. And there shouldn't be any issue with them being able to finish that within whatever 20-hour time frame they wish to start.
Great. I see a lot of heads in the audience nodding. They all like that. Thank you.
Mr. Haycock, can I just ask one question? How do you verify that 20 hours has been completed?
Thank you, Madam Chair. So the 20-hour course online through CMS will generate a certificate of completion, and we will require that all navigators, enrollment assisters, and certified application counselors present a copy of that certificate to Nevada HealthLink or to the exchange before we will appoint them for next year.
Thank you. Do we have any
Madam
other?
Chair?
Yes.
Yes, I just, for the record, Shauna Duras. So one thing is, in addition to the certificates being available to be turned into the exchange, our federal partners are providing us with lists of those people who have, that they show have gone through. We're also getting lists of the brokers that have gone through the classes. We have a member of the audience saying, when will I get those? I've already gotten an initial list of the brokers that have already taken those classes. And we should probably discuss that because I don't see certain people's names on there that probably should be on there or think that they should be on there. So we will get them from the feds as well as have the ability to get them from the individuals as well.
All right, thank you. Do we have any other questions or comments on agenda item number 5? All right, thank you, Mr. Haycock. Nice report. Next item, we don't have anything posted on it. I think it's a verbal report coming from the Consumer Assistance Advisory Committee. And so, Ms. Atkins?
Madam Chair, before we do that, there's 3 other documents on 5 on the website. Are those being discussed at a different agenda item? 5A, B, and C, he went through this. I'm sorry, I just must have completely zoned. Thank you. Okay, no, we do not have the exchange enrollment facilitator training process and schedule. I don't have detailed information on that.
So for the record, Shauna Duras, I think we just spoke about a lot of this, everything that we had on the Consumer Assistance Advisory Committee meeting this week. So as Damon just went through, we just received the federal guidance on the training last Friday. The exchange staff is in the process of putting this together to get it out to our assisters and our certified application counselors. We will post that. We will send it out on the listserv. We will do all the things that we need to do to get that information out as soon as possible, hopefully within the first day or 2 of next week. So I think that was most of, we've already gone over most of what I think we discussed at our committee meeting this week.
Yes, thank you.
So, Ms. Atkins, do you have any other, is there anything else that you want to cover under this agenda item?
No, Madam Chair, I think Damon took care of much of it, and I think this is really referring to the training process and schedule of the facilitators, the EPFs, and I think that was discussed, and the schedule just came out, and I don't have anything addition to add.
All right. Do any of the board members have questions for Ms. Atkins or Mr. Roos on the Consumer Assistance Committee? Okay, thank you. Let's move on to agenda item number 7, which is the marketing and outreach and website update presentation. Ms. Cruz?
Good afternoon, everyone. I'm Stephanie Cruz of KPS3, and we're going to today go over a very wide-reaching overview of what is happening with the marketing and outreach and the website. We're going to cover the campaign timeline, the marketing campaign details, the outreach campaign, a homepage, and very interesting results from our focus groups that we held with our target population, which I think you're going to find very interesting. They gave us some very good advice, and our next steps. So moving to the timeline at a glance in your presentation, you'll see that we started in earnest once we found out what the federal funding was on July 10th. That allowed us to start planning in earnest. What we've been doing since then is planning and a lot of research with our target populations to give us the direction that we needed to go in terms of messaging and where we distribute our messages. You'll see that we have a long yellow line at the bottom that is the re-enrollment direct marketing campaign. That's a very important initiative for us. That is our direct marketing program targeting those 37,000 approximate people who enrolled last year. The messaging on that, as you might imagine, is very critical. We need to inform them that they must enroll, and in order to be able to retain their subsidy and not be automatically assigned to another plan, that they must re-enroll by December 15th. So there's already communications that are already in review, and they should start going out next week, and we have an aggressive direct marketing program for those folks. You'll see phase one, that starts on November 5th through the end of the year. Phase two is the January time period. You can still enroll, do it before the deadline. And then the countdown or the urgency close is February 1st to the 15th. As we saw last year, a lot of people waited until the last minute to enroll. So we're going to end with an urgency close, like, please sign up now, the deadline is coming. So,
Ms. Cruz?
Yes.
Could you put your microphone a little bit closer?
Certainly. Is that better?
You. Yeah, I think it's when you're moving your head around as well.
Oh, at least I'm not moving my hands. Okay. Okay. Moving on to the media campaign details on page 6. What this is based upon is research. We are not the target audience, and most of the people that in this room are not the target audience. So we went to the target audience to determine what is the best way to reach them and communicate and what would resonate with them. We also utilized last year's post-campaign awareness survey, which told us about the established awareness levels and the brand name recognition, which is very high given 1 year's worth of efforts. We also tested messaging about the new Nevada Health Link, which we'll talk about in the focus group results. And then right now we're also developing and implementing that direct marketing program to the current enrollees, again, to educate them about the re-enrollment process. And we're working on our media mix. We're already receiving media proposals and doing an RFP for our media partners to get us the best deal on your behalf, and produce all of the different tools that we're going to need for the campaign, everything from advertising to the website to collaterals to support for outreach and the navigators and the assisters. So moving on to page 7. This is an overview of the campaign mix. This is based upon our results and the campaign awareness survey that we did at the end of last year's campaign. We had a very strong result with digital last year, so we're keeping that at a high level at 20%. That starts November 5th. We're starting that a little sooner than open enrollment. It provides a direct link to the enrollment site, which is critical. It's also very effective among Hispanic audiences and, of course, our young invincibles. Outdoor is a good message, a good reminder message. That's at 11%. We're allocating a little less than last year because of the heightened awareness that we gained in our first enrollment period. TV really was well received in last year's campaign, as reported in the post-campaign awareness survey. So we're really up the amount of television that we're running. Radio serves as a complement because it does give us some frequency of message. And then print or newspaper is very small. It's for very niche markets, including Hispanic media and our rural communities, which do take a lot of attention in the newspapers. So the paid media mix, going on to page 8, want to talk a little bit about our rationale for starting when we're starting. One of the things we did last year was have a pre-enrollment campaign. It was a new product and a new campaign, and we needed to let people know that the Affordable Care Act was coming, and there was this thing that was going to be a website where they could enroll for health insurance. That was a pre-enrollment awareness campaign, and we thought it was important given the fact that it was a new, very new product and a new concept. This year, we don't feel we need to have that pre-enrollment campaign because we have already achieved a high degree of awareness. And what we would be doing now is spending a fair amount of money in a pre-enrollment time period to advertise something that people cannot yet use. We think that that would probably make them upset. So we're not really recommending that we start much sooner than right after the elections, which brings me to my second point. The time period between October 15th and November 5th is one of the most expensive media times you can very possibly find due to the cost of everyone who is a candidate or has an issue buying advertising. That's if you can find spots or ads available. Many of them are already taken. We did do some pricing, and it would be a very expensive proposition to start advertising much before November 15th. So we really don't believe that it's a good idea. We're recommending that we start digital and outdoor on November 5th, and we start the rest of our campaign when they can actually use the website on November 15th. So in a little bit of split on the demographics and geographic allocations, 70% of the media budget will be dedicated to Southern Nevada and 30% to Northern Nevada and the rural. 70 to 75% will be on English language media. 25 to 30 will be on Spanish language only media. It's been our experience that many bilingual populations do listen to the English language media. And we're going to focus on media outlets that try to reach all of our clusters, including our Young Invincibles, which is an important audience for many reasons, African Americans, Asian Americans, and then our more senior segments, the ones that we call sometimes the sick and worried. The total media placement dollars, the hard cost, is $2.9 million. That's what we're actually going to be expending to reach the audience. Our goal is to do what we did last year, however, and negotiate a lot of value added. Our goal is 25 to 30% additional value on free spots, editorial coverage, free ads, and that kind of thing. So we're going to try to stretch that budget as much as possible.
Great. And this is Katie Coleman for the record, and I'm going to be reviewing the outreach campaign details. I'm starting on page 10. Again, we're focusing on this person-to-person approach. And we know that in outreach, that's vital, in addition to our partnerships with brokers, navigators, assisters, nonprofit partners, and community partners. We will continue to utilize our outreach tracking tool to ensure we're reporting back to you about cost per touch. We will continue to attend events and distribute literature where our audiences visit. Continue to outreach through our schools, our church communities, our colleges and universities, and places like the DMV. We know everybody has to go there. A major focus is going to be on our Young Invincible audience, also through our outreach. Again, we will produce all of the consumer literature and materials that we use in our actual outreach, and our total outreach budget is $570,000. I am on page 11. So the Consumer Assistance Advisory Committee asked that we research the possibility of opening retail spaces. These points here outline some initial plan details, and we continue to investigate the feasibility and logistics of this. We do know that enrollment activities are key to our outreach plan, and also our relationships with our navigator, assister, and broker partners are also key to our success. And I'm going to toss it over to Rob to give you a preview of the new NevadaHealthLink.com.
All right, so very similar, Rob Yadke for the record, very similar to last year. We will be developing the information-only website for the Nevada Health Link. Just to preface this, any of the design that you'll see, any of the interactions and tools that we use is all based on the UX 2013 study that was conducted for the previous enrollment year. That was done by the Kaiser Permanente Family Foundation, the California Exchange, many Robert Wood Johnson Foundation. A lot of those entities got together and produced a study. So it's really a blueprint for best practices on these types of websites. And we've studied that, and we use that very in depth to come up with these designs. Likewise, we also have an entire year full of data. We tracked a lot of our statistics and our user interactions on that info site. So we use that in conjunction with the UX 2013 to develop these tools and the design for this site. I will also add that what you see here today will be going through testing with all of our consumers, essentially focus groups for websites to ensure that all of these flows, all of these worries that were mentioned earlier, will people know how to get there? Is this button the correct button? We will be testing all of that and ensuring that our consumer experience gets them there as best as possible. So a few key features on the website. Our primary objective here is going to get folks into that DWSS pre-screener tool. So that will be a big focus on the website. Again, links out to healthcare.gov, Access Nevada. Also, we are building a Find an Assister tool. This will be a zip code, name, search. Essentially, you'll be able to insert an area and find somebody that can help you in person. I think that's a big component that we'll talk about in a little bit with the focus groups, but in-person assistance is very much needed, and we will be directing them as quickly and as easily as possible to those entities. Again, we will have a large focus of getting people into old plans and helping them re-enroll. So that will be a focus. Key dates, links to event calendars, store hours, those will also be components of this website. There's also a special navigator and assister page. Those will be built specifically to help get awareness out if things change fast or we need updates for anybody there. Similar to the last info site, we will also have search, frequently asked questions, glossary terms. This will be a very robust tool for our consumers to go and find the information that they need and again, direct them to the proper channel. We will also have contact information. We had some great meetings with the DOI on what information they would like to have and how they would like to be directed over there. Voter registration, Access Nevada, Medicaid, all of these entities will have a presence on our site, and we'll be sure that we are using those efficiently. Likewise, we will be developing a completely Spanish website. This will not be a machine translation. This is a true Spanish website that is devoted and built specifically in Spanish. The total budget for the websites comes in at $62,000. Again, that next page has some of the design. I'll talk a little bit more about that. But what we wanted to ensure was that it's new, that it feels fresh and that it feels uplifting. So if we do side-by-side comparisons, you can see it's much richer, much more vibrant, and more exciting for our users. Likewise, there's a pre-screening tool. We helped develop the interface for this one with the WSS, and so that's a sample of the tool there. So let's focus groups. I did have the pleasure of conducting these focus groups, several in Las Vegas as well as out north. And I'll let Katie talk about the characteristics of the focus group. But I do want to say that it was very fascinating, and we received some great information and guidance. So with that, I'll turn it over to Kate.
Great. Katie Coleman for the record. So as Stephanie mentioned before, we base all of our decisions on primary and secondary research. We know we're not the target audience. We know we need to talk to members of our target audience to get to the right messaging, the right look, the right feel. So as Rob mentioned, we conducted 4 groups in Reno on August 20th and 21st. Each session focused on a target segment: uninsured families, uninsured young invincibles, uninsured Hispanic families, and those were conducted in Spanish, and then an uninsured all ages and demographics group. And then in Las Vegas, we conducted 5 groups on August 25th and 26th. Again, we broke it up into these target segment groups by session. So uninsured families, uninsured young invincibles, uninsured Hispanic families, again, conducted in Spanish, uninsured Hispanic young invincibles, again, conducted in Spanish, and then that all ages and demographics group. We are very focused on how we recruit these people when we talk to them. We recruit for age, of course, also that income level. Very important to our recruitment process is to talk to the uninsured, so we recruit for that component, and then also for language. The concepts that were presented to the focus groups, and Rob's going to address those in a minute, were originally vetted by our working group. and that's consisting of board members, a university student for this year's working group, a Hispanic community leader, and then our health exchange staff.
So to wrap a framework around how these focus groups were conducted, what we typically do is we develop a general idea, a general concept around a direction for advertising. And then we give the focus group some samples. So we read a script, a sample script, and then we dive into how that sort of script made them or what did they feel about that script. So the three scripts that we developed, the three concepts, were based on last year's awareness study, as well as there has been a ton of information that's been coming out with our Young Invincible audience now that we have good data from a complete enrollment cycle. So we used those pieces of information and developed these three concepts. So packages is what we refer to the first one as. That really talked about the fact that health insurance doesn't come in a package, that the tangible results of having health insurance is that you and the people you love are happy and healthy. So that was the premise of packages. By the numbers was one that actually came to be because of a lot of the outreach efforts. When folks are having one-on-one sessions with people, they wanted to see physical numbers. So they wanted to write them down. They wanted to talk about the financial pros and cons of insurance. And so this one was a very straightforward approach. It outlined the average cost of day-to-day needs and items, and then sort of in contrast, the average cost of medical needs without health insurance. And then we sort of sum that all up with a comparison with the monthly income-based payment through Nevada HealthLink. Our final concept was a much more emotional concept. And what we found in a lot of the research was the simple fact of the matter is that $50 is the max that our consumers are willing to pay for health insurance. And so we have a tough job to do. And what we're trying to accomplish here is to move that $50 limit into a different category. So we won't be able to convert somebody unless they remove that cap of $50 and they put it in a different area. So yes was a much more emotional approach, playing on the relationship between parents and children. We converted that to young adults and their parents for the Young Invincible crowd. So parents and children pose a lot of questions to one another, and this concept emphasized the fact that when you're asked, when the question comes up about having health insurance, that answer should always be yes. And so those were the three concepts that we put in front of our audience. And the results were fantastic. Most folks said that when asked which concept achieved the goal, which the goal is signing up for insurance, that yes was the winner. That concept seemed to resonate. And again, we asked which concept gave you the most positive feeling. Because what we don't want to do in these concepts is we don't want to have one that works really great, but actually produces a negative feeling. So again, yes received the most votes. However, by the numbers was very intriguing to a lot of our audience in the focus groups. They felt that it explained a lot. However, many people were disheartened by the numbers. So that's why we're recommending that we move forward with the yes approach. And I'll drill into those on this next page, page 21. Some insights, these are actual quotes from the focus groups. It pulled at my heartstrings. It's going to touch someone and sort of make you do something to get insured. They liked how they focused that you're not going to be glad you got it until you really need it, and how relieving that can be. Finally, it's hopeful and it's optimistic. Again, words that we would like our audience to relate to. And then it makes you think about others in your family. So some insights on page 22 about by the numbers. They did say that it was honest and factual, that it makes it seem easier and more affordable than maybe they previously thought. And it empowers you to put your money where it matters. The downside, again, like I mentioned, is that it made some people feel very uncomfortable and upset at the pure costs that were coming into play. Some other suggestions to include in our marketing. Again, the concepts are just one element of these focus groups, and we wanted to get into a lot of language and verbiage. But how do plans compare to other health insurance plans was one that came up a lot in our focus groups. The usability and the ease of use of the website and the transfer to the website. Mentions of pre-existing conditions. This was another big one that came up a lot. They wanted to know a lot more info about pricing, and especially pricing in relation to family size. That came up in the Spanish focus groups a lot. And then they wanted to include a law component and talk about the individual mandate. But one of my favorite ones is this last bullet. That Nevada HealthLink was formed to help Nevadans. Once the focus groups were ending, I sort of reveal kind of why we're here and what my role is and what the role of Nevada HealthLink is. And when it was told openly that, hey, we're not an agency that's enforcing these rules, this is the rule. And we were developed to help Nevadans and to help Nevadans get insured. The room sort of lit up. And I had several people thanking me that the Health Exchange was doing this and that they were really glad they got to voice their opinion. So that was a really strong message that came through, and that's across the board on all of our focus groups. So some other insights. We talked about the new Nevada HealthLink. And that really had no effect. Nobody really understood what new meant. And the ones who did were aware of the technical issues. The ones that didn't said, well, yeah, it's a new law. 2 years, 1 year, it doesn't make a difference. It's all new. When we asked about getting assistance, again, we sort of talked a lot about phone numbers and websites and in-person assistance and what was the best use, what would people use. Most English groups preferred the online enrollment, which has been proven in a lot of the research. But then their second choice was in person. More senior participants wanted to seek in-person assistance first. Most Spanish groups preferred the in-person enrollment and then a phone, so website was actually last. There were lots of negative reactions to calling an 800 number to get directed to another organization. That was a concern of people. They didn't want to call one number only to get transferred to another. And then the idea of these enrollment stores that Katie mentioned previously, and I know there's still logistics and risks to figure out, but those were welcomed very much so by all of the audiences. The best places to reach, like our outreach and the navigators and the assisters, schools, communities, events, health fairs, those are all places that folks are ready to get information. However, our Young Invincibles, 3 groups said, don't reach me when I'm trying to have fun. Point taken.
So next steps. We will continue our work on the re-enrollment direct marketing campaign and initiative and ensure that all of our partners also have that approved messaging. Execute the media campaign components based on the favorite concept, yes, while also considering some supplemental components based on that by the numbers second favorite. Work with the exchange staff and working group to confirm all the final messaging. That kind of boilerplate type messaging, taking into account what we know the messaging must have, and then some of these other pieces our audiences told us they want and need to know. Continue to negotiate the media buys to ensure the best reach and frequency, in addition to getting as much as of that added value, free airtime, free space as humanly possible. And then continuing all of our outreach activities, events, distributing literature, presentations, and planning for enrollment activities. So with that, we'd be happy to take any questions.
Do we have any questions on the presentation of the marketing plan?
This is Dr. Ford.
Yes, Dr. Ford.
So real quick, and I might have missed it, you said that we're going to have a Spanish language website that will link to both the federal and the Medicaid websites, which I assume are also in Spanish. So am I to understand, as of November 15th, you can work the whole process in Spanish? Just want clarification on that.
I would ask if anyone on the exchange staff is aware of if the tool, I believe the pre-screener tool is being developed, both, but I'm not sure on the other tools.
Let's push that to David.
Mr. Fisher, can you help us with that?
Sure. For the record, Steve Fisher. To answer your question, yes, both Access Nevada is both in English and in Spanish. That's the application for applying for the Medicaid side of the house, as well as the pre-screening tool is being developed in both English and Spanish.
And that will go live November 15th with the English, is the plan.
That is correct.
Thank you.
Any other questions?
Yeah, this is Florence Jameson.
Yes,
That was a
Dr. James.
wonderful presentation. And I really enjoyed seeing your prototype of the homepage. It's really beautiful, very attractive, and comforting. Shows a lot of care and compassion. One thing I didn't see last year, I could have sought it out, but I did not, but I would be really appreciative as we progress this next year. I would love if you could bring your actual, some of your tools, your literature that you develop, maybe bring it to our meeting. I would really love to see it. And one thing I wasn't really clear on is, you know, I know you go to all these places like the schools and the all the places you mentioned. I know at the hospitals, a lot of it is relied with the exchange enrollment at the enrollment assisters to convey this message. Do you actually have literature that you guys put out in the emergency rooms?
Kitty Coleman for the record. You know, we did not do that last time around, but it could be an opportunity and an option for us to do that. We have the methods and the manpower to do that and make sure that people have what they need as far as hospitals and clinics and what have you. So I'd love to kind of pick your brain on how maybe we could get in there and get some information out there.
I'm just not sure when you say you put literature out at various places, churches, schools, at say a school, do you put it in the nursing office? Where do you put it? How is it disseminated? Do you have the teachers give it out in the classroom? I'm just maybe just a very brief, because I don't want to make this meeting go forever. Maybe how do you do it at a school or at a church or a hospital?
Certainly. So it really depends on where we're distributing it. For the schools in particular, we've really focused on the elementary schools, both in Clark and Washoe counties last enrollment cycle. And we actually worked with the district office to get them in their, I call them peachy folders, but you know, peachy folders, the folder that you have to take home as a kid to your mom and dad every week. And we actually developed a very specific piece for that audience, the kids and the parents, and it said, take this home to mom and dad. So we make sure that the vehicle and the materials are very appropriate for the audiences that we're reaching. In other circumstances, like the DMV, for example, we work closely with their communications office to get physical materials at the kiosks and the desks. If there's an opportunity for video materials to run over the overhead system, we make sure that they get those. And we actually have a really cool checklist so that we can go to any sort of partner and say, hey, these are all the assets that we can provide to you. What makes the most sense based on your organization? And so if it's a presentation, we go ahead and do that. If it's a stack of brochures that they can get in their displays, we do that. If it's, again, multimedia assets, we do that. So it's really specialized to what the partner needs at the time.
Well, yeah, I'd really like to see about the possibility of expanding it in our hospitals.
I'd love that. I'd love to talk to you more about that. That'd be wonderful.
Because it's the frequent flyers in the emergency room that really need it. Yep. And sometimes they don't get the information. It was interesting when you said the $50 maximum, and you used the word, and again, I always hang on every word people say.
Sure.
That they're willing to pay. So is it really willing, or did they actually express that they felt in most cases that it's all they could afford?
So it was mostly could. That was mostly the word choice. But again, that was in comparison to what they currently believe that they could reassign funds to. So once we discussed more around other things in their life that maybe could be moved for this, then it started to make more sense. But it was could. That's all I can afford. Yes. Yeah.
Thank you.
Yeah.
All right. Do we have any other questions? right, I do have one question on the pre-screening, and I don't know, Mr. Fisher, on the language on that, did you develop the language, or or is that federal language that we have to follow?
Madam Chair, for the record, Steve Fisher, we developed the language for the pre-screening tool.
Okay. The suggestion I would have on it, I caught it on the bigger screen that Mr. Haycock had. On the very last question, I'm a big person on acronyms, SSI. I mean, I understand what that is, but I think we should get away from acronyms and maybe just, if we've got enough space, spell it out so people understand what that is.
Madam Chair, for the record, Steve Fisher, I do agree with you. Yes, we need to spell it out.
Okay. Thank you.
Thank you for that recommendation.
All right. Do we have any other questions or comments on the marketing plan? All right. Thank you. Why don't we take just a 5-minute break, and then we'll come back and go on to the report on the progress of the PCG reconciliation. So it's, let's come back at 2:55. Yeah. Lynn, can you hear me? We're about ready to go back on the record. Hello? Wish we had a bell. A big cowbell. They could hear it. Are you sure the microphone's on down there? It's on. Lynn. Lynn, it's Barbara. Can you hear? Lynn, it's Barbara. Can you hear me? Okay, let's call Shauna. Look sternly so that they can see this 1 inch. Hey guys. Hello. All right, can you guys hear me down there? Oh, they still...
Everyone,
right,
can we
Shauna?
bring it down in the room, please?
All right, can you hear me?
Yes, we can hear you.
Oh, okay. Let's go back on the record then. Thank you.
Ms. Johnstone and Dr. Jameson are not here.
Okay.
That's okay.
Well, let's go ahead and get started on it. We're going to move on to agenda item number 8, which is the report of the PCG Xerox reconciliation. And Mr. Roos, are you going to conduct this part of the agenda?
Oh, sure. I can do that.
All right. Thank you.
All right. As has been reported in the past, we have had a lot of caseload, we've had a lot of questions, we have a lot of emails, we've had financial issues with the current Xerox solution. And the board had requested that we bring on an outside vendor to help us with that. We brought in PCG. We've talked about that at previous board meetings. So this is an update, and we will continue to bring you updates as we go through this process. There's 2 things here that are attached. One is the initial board report, and then one is the initial findings that PCG has provided to us on their first couple of weeks on the project, their meetings with the carriers, some of their initial findings and recommendations. And I thought that it was very, very interesting, some of the things that they said right off the bat. Communication was an issue. Even internally between Xerox and the exchange, our initial vendor, communication is a problem, let alone between the Xerox and the carriers, but also the exchange and the carriers. That we had quite a robust conversation with each of the carriers weekly in the past, and that had kind of, the carriers especially felt that had kind of gone by the wayside, and that they felt left out of a lot of information, and that they eventually maybe found something out. But they are, I'm happy to report that all the carriers are on board with going through this process, working with us, and I think they're quite excited to be part of the process. And just kind of as an aside note, they've all asked for our marketing materials. They've all asked to be part of any discussions regarding storefront activities and things like that. The carriers really do want to be part of the process going forward, and they're being very amenable to the recommendations that we are providing to them, either from the Exchange, Xerox, or PCG, to getting all of this caseload and these things resolved. So I will say kudos to the carriers. They've been really great to work with the last couple of weeks, super flexible, because we're really changing some of the ways that we are going forward, where before, say, they would wait to get an 834 report to effectuate somebody's insurance change. You know what? It takes too long. We've decided that those are the kinds of things that needed to be changed so that we could do things very, very quickly. So I thank them for that. I thank PCG for coming in and providing some of these recommendations. And I thank Xerox for actually then stepping up and saying, okay, you know what, if we need to change our internal processes to provide this information faster, then we will do that. And they've been very, very gracious to do that as well. So kind of saying that, going back through, there were two things mainly that we brought in PCG to help us with initially. One was caseload, one was member reconciliation. As we started going through this process, we found actually that they really do kind of go together. If we started down the path that they were very separate, that they were, we have to do this on the entirety, which we do, of the 38,000. We have to reconcile all those members. But what we're finding is that, you know what, if a member has a problem account where there's a caseload out there, generally those are the ones where we have member reconciliation issues anyway. So as we are dealing with a member reconciliation, a case, we're opening it, and we're going through these, we are also then identifying those reconciliation issues just on a member identity. Making sure that the names, the ages, the addresses, all of that information is correct, not only on the Xerox side, but on the carrier side. So we're able to do that at the same time that we are doing those caseload reconciliations. If you recall in the past, we brought back to you, I think July 31st, that week, we were at about 10,000 cases. This week we're down to 2,600 cases, so we're definitely working our way through there. Now, I will say this, of the 2,600 cases that we have left, the carriers have their own list of cases. Now, in many, many instances, that if I send over a list of names, they say, yes, all of those people are on our list as well, so it's a duplicate, but then they have some initial people who may not necessarily have called the HealthLink to get a case number, but they called their carrier with a problem. So while we're working through our cases, we're also working through the carrier's cases as well. And we have dedicated that we will go through our list and we will go through their list at the same time, and we will get them all resolved. So I will say that there was kind of a plan here about how we were going to do this. We're going to work through manual files. We started with literally a line by line. Here's a list of cases. Here is, we go visit Anthem or HPN, and we have a list of their cases, and we sit down and we start going through one at a time. And what we found is that a lot of these cases kind of generally fell into a certain bucket. Either it was an effectuation date issue, or it was an APTC issue, or things like that. And once we got to the point where we could identify that this was how we're going to treat this issue, then after that, as we go down that list, it's like, oh, that's like that guy up there, and it's the same issue, we're going to treat it the same way. And it went very, very quickly. And so now even the carriers are, okay, Xerox, PCG, you go through your list, you put them in these buckets, you give us your date, or you give us the resolution that you would like us to apply, and we will apply it. So what we also have done here is we've established a little bit of credibility with the carriers that as we're treating these cases and the decisions that we're making, that they agree with those decisions and they agree with the reasons that we've made those decisions. And that was a huge, right from the very, very first meeting that we had with the carriers, that was evident, that they weren't sure when we walked in the door, why are you making these decisions? And once we started talking through it, they're like, okay, we agree. That's how we would have made that decision as well. So I think that's also a big change that we're seeing, is the attitude about some of the information. And again, some of those carriers are like, just send us that information and we'll make that change. So they've also dedicated themselves that they're turning it around very quickly. So if we do send over a file and we say we need to make this change, some of them are doing it within 24 hours. It's happening much faster now. Now things got a little bit dicey when we started talking about finance, because as you know, the finance and that premium issue within the Xerox, the boss, was a little bit more difficult for all of us to work with. And because the finance part of the problems that we're having is it's a silo. We've talked about that before, that the parts don't always speak really regularly to each other. We've also worked a way around that, and we're working with the finance team to also incorporate that into the member reconciliation. And we had a wonderful meeting this morning just on how to incorporate that, because up until that point we were kind of leaving the finance cases till last because we weren't quite sure how to get those processed through, because the finance cases are the ones that take a lot of back work, because I can identify that effective date needs to be changed, but then in order to make that change, and then perhaps they have to delete or put credit memos into the system to get rid of some of these older invoices that are out there that should have never been out there. That takes a lot of time. So we've worked a way through that process, and again, everybody's on board. So saying that, I don't necessarily want to read through all of this information. It's definitely for you to come through, and you can always come back at me later and shoot me an email and if you have a question. So on the PCG Xerox carrier reconciliation, I think it's going well, and I will certainly bring back future board reports. The last thing I'd like to touch on here is the accounting reconciliations. This has been a big issue for us, and this has been a lot of work went into identifying the 4 basic different buckets that I call them of the where we still have some issues. And they're outlined here on page 3 of the report. And the first one is the short pay on binder invoices. And what that means is that that very, very first payment that a person makes, that's called their binder invoice. So we've all heard before that if you don't pay that initial binder invoice in full, then we don't send your enrollment file over to the carrier. You can't get enrolled if you don't make that full payment. So even if you're short a penny or you're short $1,000, it doesn't go over to the carrier. So what we have gone forward to do is we are literally working backwards. There's 437 people that were in that bucket. We've cleared out. I tried to get a final number for this meeting today, and I'm sorry I don't have a current number. But we started with the August. We had 4 people, last time I checked, we had 4 people who had short paid their initial enrollment for August. We got on the phone. We started calling these people. If you pay that extra $10, we can send it over to the carrier and we can get you enrolled. So we're working our way backwards through these. The other question that we're asking these people is, especially as we get later, if we get back towards, June, May, April, do you want to effectuate your coverage at this point? Have you made other arrangements, or would you like us to refund your money? Because we have this money sitting there, and it either needs to go back to the client or the client needs to pay the rest of the money so that they can effectuate their insurance. And what they need to realize also, and that we go through this education process with them on the phone, is that even if they started and they made that initial short pay, say in April, if they pay the rest of it today, that effectuates insurance in October. It doesn't go backwards, okay? Final payment today, we have to follow those payment rules. So that's an education process on the side. The next step we're also taking is we're taking the opportunity as we get these people on the phone and we're finalizing, or even on the caseload side, we're also reminding everybody that they have to come back in and re-enroll starting November 15th, because most people are unaware of that at this point because we haven't started our marketing campaign yet. So we have the short pay on binder invoices. That's the one bucket. We also have short pay on recurring invoices. Now what this means is that the person made the full binder payment. They effectuated their insurance. But when the next month's payment came, they were short. So that sits there. So say, let's go all the way back and say they made a full payment in January. February comes, they're short $10. So that sits there. We can't send that money over to the carrier. So, but then when they make their March payment, because it's always the last invoice first, they take $10 from the March payment, they apply it to February, and now the February money goes over to the carrier, and that person's good. But now they're short $20, say for March. When the April payment comes in, that $20 goes forward, and you see this is a recurring problem. Eventually, depending especially on how much that premium is, you could get to the point where you've made a payment and there's nothing then to forward. You don't have enough. And what happens at that point is you go into that delinquency status and the carrier may eventually terminate that account. So we are also reaching out to these clients. We are sending them notices. We are getting on the phone. We are sending emails. And we are working through this client list also, starting with those people who are at that 90-day, because those are the ones that are in jeopardy of being terminated. Those are the people that we're starting with on those lists to get through and make them understand that, you know what, you have this situation and we don't want you to get to that point where you would be terminated. So then you have a suspense, what we call a suspense account. Now, the suspense account is, so how this works is when somebody sends a check to our bank box, to our PO box, it goes directly over to the bank. The bank opens up that envelope, they see that there's a check there, and if it looks like, yep, there's a HIX ID there, they also check it against the list of all of the people that Xerox has provided them, all of those HIX IDs, and it says, yes, this is an active account. If so, they deposit that check, okay? And they work it through the system to then apply that check towards that person's account. So if it appears that we got a check that was on the list and it looks like we can apply it towards that person's account, we've deposited the money. Sometimes what happens then is we find out, ooh, that wasn't that person's account, or they've got a wrong HIX ID, or there's something like that that's taking us some time. So we do have an account that's got money in it where we haven't been able to apply it to a correct account. So in that case, we're also reaching out, we're researching. That, I think, is one of the areas where we've had the highest success rate. We are down to I think 60 items in that particular account right now that we're still researching and trying to apply. So then the last bucket of money here is what I would call an unprocessed item. So if the bank gets a check or say a money order and it doesn't have a HIX ID or it doesn't have a name, and they look against that Xerox list and they go, well, we don't even know who this person is, then they can't deposit it. There's nothing to deposit it against. And they literally send those checks back to us, okay? So we do have a stack, say, we have a bucket of money that adds up, you know, and we then have to look and research. Do we know these names? The latest thing is we're trying to cross-reference with Medicaid to see if maybe those people ended up in the Medicaid stacks. So these are people that, again, we may never be able to identify, and if they don't come forward and ask for any kind of a refund on this, then there are rules in the state about what we have to do with those funds and turning them over to the state treasurer's office and things like that. So these are the 4 buckets of money that we're working through. Some of them may end up with refunds, some of them may end up being eventually applied to the proper account, things like that. And again, I will come back to future board meetings and hopefully get to the point where I say the bucket is empty. That's our goal there. Other than that, if you have any questions, that is the end of my report.
Do we have any questions for Mr. Rose?
Madam Chair, I've got several. This is Leslie Johnstone.
Thank you. Go ahead.
You started with enrollment reconciliation of 2,600 outstanding issues that are on our list. What is the total that, not duplicate, what is the total on the carrier's list?
I don't have an unduplicated, it would be, last count that I had, which is a couple weeks ago, the carrier, all of the carriers, including dental, was at about 8,000. Now that includes the duplicates. So even if you pulled 2,600 off that we currently have, you know, it's still quite a large number, like I said. So we are working through ours and we are working through the carriers then.
Okay. I would like us to have the mental approach that the carriers list is also our list, rather than thinking of them as 2 separate buckets. I know it's our problem as well.
It is.
What is the plan for getting, so that turns out best case scenario around 8,000 cases. Mm-hmm. What's the schedule for getting that reconciled?
So again, I apologize, in looking at what we were thinking of the 2,600, the plan is the way we've set out our numbers, we plan to be through that particular group by mid-October. And in the meantime, we are also closing out, say, 2,600 of theirs, and we will continue to work as fast as possible on theirs. I don't have a target date to have all of theirs closed out at the same time.
Yeah, I think
I will work on that.
As one board member, what I'd like to see going forward is, here's the schedule, here's how fast we've been getting this caseload down, or these unreconciled items down, and does it actually trend to our target date of October, mid-October?
Sure.
I can, because you have to appreciate we've heard a lot of dates.
Sure.
Then the second category, I think, was separate from the 4 buckets. You referred to it as financial cases.
So the caseload that, so you have caseload, somebody's caseload, somebody calls in with a problem on their account. That account may be something that also touches on a financial item within the BOSS, or it may be something that we can fix without ever having to touch finance. So out of that 2,600 bucket, about 1,300 of those cases, about half, touch on finance.
And those are separate and apart from these 4 buckets that you talked about later?
Yes, yes, absolutely.
And what is the schedule? So those, if you get the 2,600 taken care of by mid-October, that includes this 1,300 that are financial?
Yes, it does.
All right.
1,300. Yes. Yes.
Yes. Then, in the 4 buckets, what is the schedule for getting these things reconciled? So the binder payment?
So the binder payment, which was approximately 437 people, we're less than that now. We're hoping to have that done within the next 2 weeks.
Okay.
The recurring invoices bucket.
Well, first of all, how many are in the recurring invoices?
It was at, when we started, it was at about 2,600. It's a little bit less than that now. I'm sorry, I was trying to give you those numbers exactly on those 2 particular buckets, and I was unable to get that today for you.
And that's separate and apart from the 1,300 that is part of the first 2,600?
It could be duplicates. It could be duplicates, yes. If somebody called and they were having a problem and they had they called and created a case for it, absolutely it could be a duplicate amount there.
So in the example of being $10 short back in February and how that continues to be a problem, I mean, that's not really a system problem if they genuinely didn't pay the $10. So are these 2,600 really system problems or just short pays?
So there's some duplication there. So the reason that they may have short paid could have been because way back when we were, say, having APTC problems or something like that, they got a screenshot that said, I owe $100. And then later, when say we had to fix a release that fixed an APTC issue or something like that, and now it says, you know what, you owe $110. And they still have been paying that $100. Even though we send them invoices, we send them all the information that says, you know what, you need to be paying the $110. We understand we had a problem, but now the very next month we informed you that there was a system glitch and now we have fixed it. So in many cases, it could be both again. There's a lot of duplication here.
Okay.
It's very hard to get an unduplicated count.
Okay. And then the 60 in suspense bucket, what's the schedule for getting those?
Again, that just comes down to research. Can we identify these people and where it needs to go? We started off at a much higher number, so now we're down to the hard ones. So I would hope that within a very short time frame that we would be able to identify all of these people, but I can't guarantee that if we just can't figure out who they are.
Is there a PCG resource working on just suspense, or how are people?
So PCG is not working on these particular buckets per se. This is a Xerox effort, and Xerox is on the phone calling these people because you have to be on the phone. You have to be able to see their financial information in the accounts, and you have to be able to look it up to call them. So that is not
Can PCG not see that information?
PCG cannot see that information.
Would it be possible to get PCG to do it so that they could do the work?
My understanding is that we don't have enough licenses. We have asked. We are looking at doing it on a data dump, like dumping all that information down so that they could have the information that way, and we are working through the process to try to make that happen.
Then in your last bucket of the M process, you may have said it, I didn't hear a count on how many.
No, I don't think I said it. Right now we have 26 items.
Okay. All right, so we roughly have a quarter of the population with an issue. If we have 40,000 lives in there, we've got 10,000 issues outstanding. Okay.
But that's not unduplicated.
Well, I think it would help to see the progress that we're making in each one of these buckets and what the actual numbers are.
Yeah.
Thank you, Madam Chair.
Dr. Jameson?
Florence Jameson.
Yes.
Thank you, Madam Chair. She's asked some of the questions I had, but what I was wondering is, of course, what we're going to learn from all this, and I know we're going to be with the federal hub. And what I'm wondering is, of these problems, what percentage do we kind of attribute to maybe the site we had before, the program we had before, Xerox? How much of it might be maybe issues that if it was any at the carrier's end? How many was the APTC advanced tax credit? I mean, of the problems that we noted, like it sounds like there's probably a half a dozen pretty recurrent problems. And going forward for our next enrollment period, have we got a plan so that none of these will recur?
So I think by its very nature, some of these won't reoccur, right?
Maybe most of them?
So we're never going to be able to stop that error of somebody just paying the wrong amount and short paying. But
could I interrupt you there just for a minute? Sure. How often, this is what I just can't understand. How often did someone just literally, do you think, pay the wrong amount, or was that primarily generated from our end and then they continued to pay the wrong amount? I mean, to me, it's very hard to understand that people would get a bill and just, you'd have hundreds of thousands of people sending in the wrong amount unless they had an invoice that said otherwise. And so that to me seems like it would be fairly easy
to get you the
remedy.
percentage.
I mean, I just don't understand that people are just getting invoices and sending in short payments.
I agree that that's very hard to understand. I also have a hard time understanding that. But if you get a bill that says you owe $100 and you send in a check that says $80, that's $80.
Well, I would be very curious how often that actually happens.
It happens every month.
But I mean, significant percentage of
I
our
have 26. I have about 2,700 people in that bucket that we're working through. And I cannot tell you.
Dr. Jameson, I think I can offer a little bit to it. If you remember that our target audience is down at 138% to 400% of the poverty level, there are going to be very many times when the invoice comes in and they're paying just the best they can at that point in time, hoping that the coverage continues. So I think this is something you're going to see. We won't see it on the finance side once we switch to the federal platform, but the carriers are bound to see a lot of this on a go-forward basis.
Do we have a statement on the invoice that says if you do not pay this in full?
Yes. There every disclosure, we've looked at the disclosures, but it's just a matter of they say, if $50 is all that I can pay, and the invoice is for $125 and they submit $50, that's the best they can do at that point in time. I think I've got navigators here nodding and saying that's, this is going to be a recurring issue in every market.
Yeah, I'm actually along with. I think we have to realize the population that we are, are dealing with. For the most part, these are people who don't have a lot of money. So they get a bill, and that wouldn't just happen with us. They get a bill, and it's for $140, and they say, I can't pay $140, I'm going to pay $100 on this. And they figure that'll keep it in force, at least until they can pay the rest. And that's not unusual for, at least I have found in my, social service work. That's not unusual for people who don't have, a sufficient amount of money to be able to pay all of their bills.
Madam Chair, may I just ask a quick question? I have all the same questions that everybody else does. How many of these are people writing checks, and how many of these are people either on auto pay or are paying on a credit card that don't have the ability to select how much? So I'm trying to, how many of these problems, or are all of these problems people writing checks, or are these problems checks and credit card processing?
So our system, Shauna Durst for the record, our system currently does not allow you to short pay with a credit card or through the IVR. So if you call, you can't say, I only want to pay $100 with my credit card.
you can't do that. It just won't allow you to do it. So you can send a money order, you can send a check, and you can short pay it that way, but you can't do it with a credit card.
Okay, and I guess then I'm going back to Dr. Jameson's question too. How much of this how much of this is our initial error, which may be continued? Because it seems to me, it seems to me that if we told them at the beginning, your monthly payment is going to be $100 a month, and then, however, a month or two later, we say, oops, we goofed, and now we're sending you a letter. How confident are we that that letter is getting to them or that information is getting to them? I mean, and why is it, I guess I'm also trying to figure out once we gave them possibly incorrect information, if they pay it, that doesn't sound like they're getting their insurance back to that date. I'm kind of hearing that their insurance is starting kind of when they catch up, and I'm just not sure how much of this is our responsibility and how much is
different
theirs.
bucket.
Okay, different bucket.
Different bucket. So for the short pay on the recurring, as soon as they make a payment, it gets paid and it goes forward. Okay, the people who would not get a backdated start date are the people who didn't pay all of their initial binder payment.
Thank you.
Different.
Okay. Thank you. So, but I still am concerned about the initial, when people signed up initially, we're told this is how much your insurance is going to be, this is how much your APTC credit is going to be, and then all of that kind of changed, and that's where this mess is, that things were miscalculated at the beginning. And so now people, so anyway, I'm trying to figure out what is our responsibility, and agree with Dr. Jameson as well, that we have to make sure that none of this, or that as little of this can happen in the future. I don't know, this sounds like a really big ongoing issue that we're still dealing with.
And if I might just interject, I think it's always going to be our responsibility to make sure that it's resolved. It's just part of what we have to do. I do have a question for you, Mr. Roos, though. In going through the carrier questions that they have on their caseload, we do have some timelines that must be met because they have some reporting obligations, I believe, to the IRS by December. Is PCG and you said Xerox is working on this as well? Are we going to meet that time frame for them?
We are going to meet that time frame.
Okay.
We have every intention of meeting that time frame, and all of the milestones so far for the 1095 reporting have been met.
Okay. Where is PCG working on this? Are they working on it at each of the carriers' offices?
You mean physically?
Yes.
You're looking to where they're physically sitting?
Yes.
Is that the question?
Yes. Where are they working? Are they actually sitting down?
Can you hear us?
Yes. We lose it? Oh dear.
There you go. Be salty, cheesy.
All right, can you,
There you are.
all right, can you guys hear? Can you hear me?
Yes, we can
Okay.
hear you.
All right, let me go over the question again. What I wanted to know is we have retained PCG to come in and do the reconciliation and whatever tasks that we're directing them to do. Are they doing that from Boston, or are they physically sitting in working with carriers at their offices so that we can move through this more quickly?
So it's both. It is both. So some of the carriers enjoy the one-on-one, face-to-face, because their team is all in one location. You have other teams such as Anthem. Anthem, their team is spread out all over. So those we're working through WebEx and teleconferencing and things like that. And it's still going quite well. So it does depend on the carrier. And it does depend on the initial meetings were, we had some in-person meetings initially. As we go forward and we, like I said, we identify, say, certain buckets and everybody agrees how we're going forward. A lot of those are just happening via email. We send you a list of 100 clients. This is how we think we should resolve these cases. And if they agree, they send it back and say, we agree. And that face-to-face is not needed at that point.
Do we have PCG sitting down with Xerox and helping them on their reconciliation?
So PCG has been in Nevada, I think each week for the last 3 weeks, and they plan on being here next Tuesday. This is the first week that they weren't here. They plan on being here next week again. And so they definitely have a presence here. They definitely, again, have that teleconference presence with each of the carriers.
Okay, and then lastly, I would agree with Member Johnstone that I would like to see a timeline on the finality of all the reconciliations. Do we need to turn that off and turn it back on?
Madam Chair, may I ask one final question, or a question, I guess?
Yes.
Another question. So just so I am really clear on this, the suspense account are folks who might say, I'm making payments, they are being cashed, but I don't have an insurance card because the carrier doesn't know, or that's not those folks?
It could be as we work through it.
Where else would those folks fall? Which other bucket would those folks fall in?
Not necessarily in one of these buckets. So say you were sending in a check and paying for me. So if I don't, and say you have the wrong HIX ID on your check. And so it looked like you had a HIX ID, so we deposited it. It looked good. But then when we realized that wasn't your HIX ID, and we don't know who Lynn Atkins is, and Shauna DeRoos is the one that has insurance, but there's nothing on your check that would tie that together, we have to try to reach you and call you and say, hey, who did you write that check for, right? So those are the types of people who may end up in there. So it's not necessarily, it could be, but generally, that's the research that we have to do.
Okay, but that bucket's fairly small at 60. 60 is one is too much, but that bucket is one of the smaller buckets. So then the unprocessed items are people who are sending things in and we have not cashed anything. Correct. We have not, that those checks are just sitting there. So someone is not saying that money's been taken out of my checking account and I don't have anything there, just that check's never been cashed.
Correct. Okay. Unless, we also have money orders. I mean, so now somebody has put front cash to go buy a money order. But if I've gotten a money order and it doesn't have a HIX ID and it doesn't have a client name and it doesn't have any identifying features on it, it's very, very difficult for us to do much with that.
And I guess one other question then on the 60 and the 60 suspense and the 26 unprocessed, are those just from the last 30 days?
No.
Or are those, so some of those items could have been sitting there for the last 6 months?
They could have. It was a much larger number. This is what we're down to.
Right, but are we still getting in? Are we still getting in stuff that we don't know where to put it?
Yes.
I guess. And are we able to look at these numbers and say these numbers are of the last 30 days because we've cleared all the backlog up? I mean, am I questioning?
I guess. Are you asking if we got to zero at some point and these are 60 new cases?
I don't know that I'm asking specifically, but yes, are these cases that are mostly checks that are dated July?
What's the oldest of these cases? I apologize. I don't know that off the top of my head, but I can include that in my next report. We've never gotten to zero.
No, I know that. No, I know that. Sure.
Okay.
Okay, do we have any other questions?
Yes. Just the one I earlier. Maybe you could give some thought to determining which one of these we can definitely put some measures in to prevent, although I can see that some of them will always exist. And let us know how you're going to implement that for our next enrollment period.
So we won't be handling any of the financial accounting in the next open enrollment period.
Right.
So I think we will have less insight because it'll be on the carrier side. And while the carrier can report back to us if they're having particular issues, I think our ability to effectuate any change there is going to be less. So, but we can certainly come back and say, these are the things we've identified. People maybe couldn't pay enough, and they've told us that on the phone as we called them, or they transposed a number that can, possibly do things, things like that. Maybe we can come back and bring you some of the reasons that we're discovering as we call the people. Would that help?
Well, as Madam Chairman said, even if, we're still responsible to make sure, follow up, that these people have their access to their insurance. And if we should have reporting figures from the carriers if there are still people in similar buckets, even with them. I mean, it was one of the most difficult things for us when we tried to get early on when this problem started developing, the data from Xerox on the people, the funds that were left in the account that weren't applied to any particular insurer client. And I don't want to go through that process again, not knowing what is building up out there. And so I'm sure that the insurance carriers, being that they do find the finance usually, they probably have some better controls and certainly reporting in place because of the nature of their business and the importance to satisfy their duty to their client and also be financially fiduciarily responsible to their company. They've got to figure out these things better than, unfortunately, we have with the Xerox situation. So I'm sure they probably have this stuff available. I think we should know that information going forward always. I will see what I can find out.
Right, I think the comments are well taken, Dr. Jameson, and maybe in the next agenda item, we can discuss a little bit further how we might do that.
Madam Chair, we were having a hard time hearing you.
I think we've got a problem with the mic again.
No, that's better.
Much better.
Much better? Okay, thank you. No, I think that staff has heard what your comments are, Dr. Jameson, and under our next agenda item, we might just discuss a little bit more how we might require that type of reporting. And I would also ask that Mr. Rich can give us an overview of what type of reporting is asked for from DOI from those carriers. That might be helpful as well. So any other questions on the PCG reconciliation? I think Mr. Roos knows, has taken note of the questions that we've asked and will be preparing a more detailed report for us for next month. All right, let's move on to agenda item number 9 then. And this is really a discussion only item. We didn't prepare anything for it, but based on what was happening and what we have learned within the reconciliation and what we continue to learn, I wanted to have on the agenda the discussion of adoption of rules in this particular area. I'm not sure that we need rules, but I wanted to have the discussion here on it because if there is a gap in either federal rulemaking that we need to adhere by, or if there's a gap at DOI or somewhere else along the line, then I think the Attorney General can help us establish what type of regulations we do need to have. So that's why we have agenda item number 9, even though we don't have any material backup to read on it. And I had asked Mr. Belcourt to just kind of do a prep for us so that we could talk about it a little bit and know that this is probably just going to be free-floating at this period of time. But I still felt that it was appropriate that we had the discussion at this point in time as well.
Dennis Belcourt, Deputy Attorney General, for the record. This agenda item is there to address any possible solutions that might be needed to on agenda item number 8, or might be identified for agenda item number 8. The exchange.
Mr. Belcourt, can you pull the microphone closer to you? We're having a problem hearing you.
I'll try to do that.
Or Nick,
you can hear me now.
I've been told to ask you for you to turn it up, please. Pope.
Okay. Can you hear me?
Not great.
Okay. Not great. I'm about near the microphone.
Maybe use Ms. Campbell's microphone. It seemed to be doing a little bit better.
Okay, can you hear me?
You need to turn off the air.
Can you hear me?
Not very well, but why don't you try it and speak louder?
I'll try to speak louder. Can you hear me now?
That's better.
Okay, because the neighbors can hear me too. Yeah, thank you. Dennis Belcourt, Deputy Attorney General, for the record. This agenda item was put on there for in case an issue came up from agenda item 8. A solution to the reconciliation issue needed to be done by rule. There's certainly a lot of the way the exchange adopted rules in this area was through the carrier onboarding process, the Q&As, and you already have kind of a set of rules. They weren't put before the board as regulations. This body is in kind of an unusual circumstance where it's totally exempt from 233B. And it's, I think that's appropriate given obviously the way you have to operate on a quick mode. But you can it's within your power to adopt rules in a fashion as you have done from time to time under 233B like procedures or proceedings, or you can authorize staff to set forth rules. And I think that's where the carrier onboarding came in, is the staff was had to come up with rules to deal with each and every situation. And I think Shauna mentioned that they've basically come up with rules along the way with working through the reconciliation process. Those rules aren't set down in writing, as I understand it. They said, well, this case is like another case we dealt with earlier today, and therefore we're going to follow the same rule for that. So you have a lot of flexibility to adopt a rule in a very formal manner or on a very informal manner. The issue comes up, of course, is what's the best way to do it. And my experience is that some agencies have wanted to go and vet everything. Other agencies have found it impossible to vet everything, so they come up with rules that sometimes they don't vet entirely, and people live with that. It works. So there's really no hard and fast requirement, given that you are exempt from 233B, as to how you adopt rules or what rules you would want to adopt. The important thing, of course, I guess to think about is, the reason for vetting possible rules is to get input from other people so you don't make mistakes. Logical, right? In some cases, you may want to do that in areas that are fraught with dispute. Recently, the exchange has had come before some concerns from carriers about when to terminate, how do we terminate. There are rules with regard to that under the Affordable Care Act regulations. For example, 45, 156, 270. Those also call for exchange rules to be developed to implement, how to terminate. And so in those cases, you do need, we need to probably take a look at 270 and see if the exchange has met those requirements, whether it wants to do so through a board rule or through what I would call a staff rule. And so that's one thing to consider. And I think we're still working through the issues that the carriers have brought to the exchange about terminations. And so I guess it's probably premature to talk about that. But I'm not sure if this is answering the questions that the chair had, but I'd be certainly glad to give her mic back to her so she can ask further questions.
No, and my suggestion would be that as Mr. Roos goes through some of this process and we start getting some of the reporting back, that when we start to identify what problems are out there that really we need to have more of a written policy on, that then we can move into rulemaking on that if it seems appropriate for the new state supported model that we're going into. But I know there were some questions about carriers and short pays going forward into the next enrollment year. And Mr. Rich, do you have, can you give us an overview of what a carrier needs to report back to you if they've got short pays, or are there rules on that? Or maybe we need to give you time to go back and research it too. I'm catching you off guard on that one.
No, that's not a problem at all. I'll try to give an overview from what I understand. Title 57 is very large, and there's a number of statutes and regulations that we look at when we regulate the insurance companies. I think the challenge for us is trying to understand the federal rules and how they coincide with existing state rules. As Mr. Belcourt brought up the issue of terminations, that's probably our biggest concern, and making sure that consumers have been treated appropriately under the law. And we're looking at that, and we're working with the staff from the exchange and working with the carriers. And I think we're very close to identifying what should have happened, and we will work with the carriers moving forward on what should happen when they don't get full payments, when they don't get payments for a few months. I don't think they fully recognize at all times what they're supposed to be doing, because this is such a fluid environment, and no one's ever gone through this process before. But we are taking action steps. We're working with the exchange. We have initiated a financial examination of the two TPAs that Xerox has worked with, and we're going to find out where this money went. So I think we have our processes in place. Just like any other regulated entity that we regulate, we wouldn't allow them not to send these monies forward or to where they're supposed to be going. So we are examining them as we speak. I can't comment on that, but we're more than willing to work with the exchange on what we should be doing moving forward. I think as we move to the federal site, most of these issues go away because there's direct billing with the carriers. This is what they do. They understand the rules. They're getting the money or they're not getting the money, and their consumer folks are calling these people and saying, hey, you're short, you need to send this in. They'll send the appropriate correspondence. So I don't really know exactly what you're looking for, but I'm more than willing to work with the board and your staff to try to provide any information we can to help move this forward.
Well, it sounds like some of that area falls under rulemaking under Division of Insurance. But as you're going through the process, if you find that there are things that we need to do on the exchange side to complement that, or that there's a void somewhere that's under our jurisdiction and authority, then we would appreciate the DOI giving us that information as well. At this point, I can't identify anything. I just want to bring it to everyone's attention that is there. We have it available to us. And as Mr. Belcourt said, if we get into an area that tends to be controversial, where there are a lot of different opinions, that probably is the point in time that we do need to go into, rulemaking for the exchange for clarity to all those involved.
Madam Chair, this is Leslie Johnstone.
Yes, Ms. Johnstone.
I can remember asking months ago for us to start working on documenting what the rules are. I don't know how many rules we need to create. It seems to me between DOI and the federal statute, we could document quite a bit of what the rules are, and then that make it easier to identify where the gaps are that the exchange needs to make up a rule. I would ask that we go ahead with getting all of that documented, regardless of what happens with these reconciliation activities, because the carriers need to know sooner rather than later what the rules are going forward when all of this burden is on them next year. And I think we as the board and the public needs to understand what these rules are, not after we've gotten into a discrepancy.
Any other comments? All right. Well, I think staff knows that I think there's an interest from the board to at least examine those areas that we need to start rulemaking on, or maybe just clarify where we go to look for those rules by referencing the federal code or referencing back over to Division of Insurance.
Madam Chair, do we need a motion on this? I agree with Ms. Johnstone, and I don't know if we need a formal motion since it's an action item to ask staff to prepare such a document.
You know, I think staff's heard it. I don't think we need a motion on it unless Mr. Belcourt says, no, he's shaking his head. I think the minutes will reflect that the board wants us to move in that direction. So. All right, if there aren't any other questions, then let's go ahead and we've done item number 10. Let's go to item number 11, which is the update on the enrollment statistics. So, Ms. Rich.
Thank you. Laura Rich for the record. So in the interest of time and the fact that we are outside of open enrollment and there's not a lot of change in the enrollment statistics as far as the breakouts and things like that go, I'm just going to provide a really quick overview. I did want to focus on our enrollment, though. QHP plans, last month we were at about 38,000. We're down to about 35,000. And Mr. Roos touched on that earlier. We have process terminations, which is the reason for the decrease in enrollment. And when I say process terminations, it means that the carriers were notified of a non-payment issue. So if a consumer failed to pay for they exceeded their 90-day grace period, the carriers were notified of this, and this is the reason for the drop in enrollment. Similarly, the dental plans also were decreased. Last month they were about at 30,000, and this month they're looking at about 24,000. Call center statistics, they're pretty consistent. Metal tiers, enrollments by carrier, all those remain pretty consistent. By service area as well, age. Our qualified life events, the board had asked for an update on that. And to date, we have about 2,000 qualified life events that came in. So about 395 of those were from in-force members, meaning they're already consumers, and about 1,600 of them are new consumers. So these are people that experienced a qualifying life event trigger, which meant that they were eligible for a special enrollment period and came onto the exchange outside of that open enrollment period. So as promised, that was a really quick update. If you have any questions, I'll be willing to answer them.
Do we have any questions on the enrollment statistics? Yes, Ms. Teska.
Thank you. Julia Teska. On qualifying life events can also be a reason why someone no longer is on the exchange, correct? If they've gotten a job that now provides health insurance from the employer, and so they would no longer be eligible for exchange insurance. So are the terminations or the drop in enrollment, is that exclusively due to non-payment, or is it also due to people who may have qualifying life events that are making them no longer eligible for the exchange?
For the record, Laura Rich. No, these are not exclusively terminations due to non-payment. You can call in and terminate your coverage. So there have been many people that have called in to the call center and have requested termination of coverage.
Do we have any other questions? Okay, let's move along to monthly budget projections. So, Ms. Eaton.
Thank you. Carrie Eaton for the record. This month's report will cover how the state fiscal year 2014 budget has ended, the work being completed to open state fiscal year 2015, and the status of our 2016-2017 budget building process. The table on page 2 reflects the total actual ending revenues and expenditures for state fiscal year 2014. The exchange received and expended a total of about $23 million through 6 federal grants and per member per month fees. Of that amount, $750,000 was an advance that was returned to the state general fund, and $524,848 have been placed into our cash reserves to move over to state fiscal year 2015. Our first level 1 and second level 1 federal establishment grants were fully expended during state fiscal year 14. And that pretty much wraps up state fiscal year 14. For state fiscal year 15, which is our current fiscal year, we are now 2 months into fiscal year 15, and staff has submitted 5 work programs, which are essentially budget revisions, which will balance forward authority for each of the 4 remaining federal grants, and also balance forward the $524,848 in reserves. These work programs will be reviewed at the interim finance committee meeting on October 22nd. And after that meeting, I can bring back a chart of our final beginning budget for this fiscal year. And the budget building process, our agency request budget has been completed and is now being reviewed by our budget analyst and the Legislative Counsel Bureau. And pursuant to NRS 353.210, our agency request budget remains confidential until October 15th of 2014. So the only part of that budget I'm allowed to share at this point is our contract information, which I've provided on page 4. And the only thing I have to add about this is that a budget hearing to review this budget is scheduled to occur next week. And we may be making additional changes and things like that. So I will be glad to answer any questions the board may have.
Do we have any questions for Ms. Eaton on the budget? All right, and so the $750,000 advance has been paid back to the general fund, and we have a $500,000 set aside in reserve then? Correct. Okay. All right, that'll move us on to agenda item number 13 for possible action on and other dates, times, and agenda items. Our next scheduled board meeting is Thursday, October 9th. And do we have any requests from board members for that agenda? I'm going to note before we add anything on to that reconciliation, a more detailed reconciliation report at that point in time. Hopefully we'll have a bucket or 2 that's empty. So do we have any? Ms. Johnstone?
Leslie Johnstone. I don't know if there will be a demo of the pre-screening tool and or the new Nevada Health Link site.
So for the record, Damon Haycock, the new Nevada Health Link homepage is scheduled to be available for a demo on October 9th. However, we are working with the Division of Welfare and Supportive Services to have access directly to that pre-screener per your earlier request. They currently had it scheduled for that week to go into testing. And so if the testing proves fruitful, we will be able to unveil it at that meeting.
Thank you.
Do we have any other requests for the agenda for October 9th or for November or December? Okay. All right, let's move on to public comment. Do we have any public comment in Henderson?
Yes, we do.
All right.
Please step forward.
You'll probably say what I was going to say. Madam Chairman, let's.
Dwight Mazzoni, for the record, a licensed insurance producer, state of Nevada. I have two commentaries to warn the board about, you might say. From 11:15 to 12:15, we have, if you throw out Thanksgiving, 19 working days to try and get 30-some thousand people re-enrolled. Just be aware of that, so if we're screaming and hollering at you as we're trying to re-enroll, understand where we're coming from. We're just trying to do the job of getting enough people in so we can pay the bills for the exchange next year, right? Number two, in all of this go around about the FFM and being certified to sell in the FFM, I was doing some research thanks to Vicki and some other stuff, and I have uncovered the problem, my dear, and I shall share that with you, and we will make a concerted effort over the next several weeks together to get over the 160 number of people that are FFM, quote, certified, finalize the certification. There's a little step in there that's kind of hidden, and you have to know what the heck to do with it. I discovered it while we were sitting here today working on it. So we can probably add a whole bunch of people to that. I wasn't quite sure when I stepped up here whether or not I agree totally with you about stay the course, cancel track 2, or anything like that. I guess my comment would be, as long as the state of Nevada can stay a state-based exchange, and that be the track that we take from now ad infinitum, ad nauseum, as it goes, then I am okay with it, and I think we will have a much easier job of selling that to people on the producer side, as well as the navigators and the CACs and the assisters and all those people. I think if we were going to go to a straight federal exchange, it would create horrible, horrible tragedy among us, and I agree with whoever made the comment, I think you did, Lynn, that, or maybe Dr. Ford did, that if we try and go a third route or a third change, that we would totally screw up everybody in the state of Nevada. So I don't want to do that. I want to make this thing work and make sure that we can stay the course. I think one of the things that we keep forgetting is we have 100 and some odd thousand people that went Medicaid, and the 30,000 people that went qualified health plans. Those are the qualified health plans are the people that are paying the bills here, and we need to really focus on how to service and take care of them over this next, I don't even know what the time frame is going to be, but whenever we start this open enrollment process. And I would urge this board to pay particular attention to that process. How can we best help it? I understand the carriers are talking about such things as if someone doesn't re-enroll through the exchange, that they're going to be able to roll right over to the plan they have with that carrier. And then figure out later what they can do if they need the APTC or what's going to go on. So there'll be some very interesting things. And there's going to be a lot of research work going to have to be done vis-a-vis the consumer and what the consumer will expect and be able to do and keep coverage, not keep coverage, or whatever. I think we have a tremendous lot of work to do for us, for the citizens of the state, and hopefully I know this board will do a good job of trying to do that and help everybody, and hopefully we'll get a strong vote of support from the people that are meeting today and tomorrow at the Puzzle Palace in Carson City. Thank you.
Thank you, Mr. Mazzoni.
Thank you.
Any other public comment in Henderson? That's it down here, Madam Chair.
Thank you. How about here in Carson City? No comment here. So with that, I will thank everyone, and I thank staff for putting together all the documents and everything for our review. We'll see you October 9th, and thank you very much. We adjourn the meeting.
I never know. So getting my